How to prepare for NHS consultant job interview. In an NHS consultant job interview, you'll be assessed not only on your clinical knowledge and experience, but also on your understanding of leadership, service development, teamwork, and NHS values. Here's a structured guide to what you need to say during your NHS consultant job interview, with clear examples to illustrate your points. This will help you sound confident, comprehensive, and aligned with NHS values and the expectations of a consultant post. Number 1. Introduction and personal statement. Let them know who you are. Provide them a brief career summary and your key achievements. Explain why you want to join this trust. Show them your knowledge of the hospital, department, population, and how you align with their needs. Emphasize your unique value. For that, highlight what you bring to them: clinical expertise, research, teaching, leadership, or service development. Example: I'm a respiratory medicine specialist with over 10 years of NHS experience, completing my specialty training in the Northwest and receiving circuit last year. I have a strong interest in lung cancer pathways and service redesign, and I was drawn to this post because of your innovative community respiratory hub model. I'm particularly passionate about reducing diagnostic delays, and I believe my audit work on early cancer detection would contribute directly to your ongoing pathway improvements. Number 2. Clinical experience and expertise. What to say: breadth and depth of your clinical skills. Complex case management. Evidence of safe, evidence-based care. Example: in my current role, I manage a wide range of complex respiratory conditions, including difficult-to-treat asthma and interstitial lung disease. One particularly challenging case involved a patient with suspected hypersensitivity pneumonitis. I led the multidisciplinary investigation, coordinated bronchoscopy and imaging, and engaged occupational health to determine the cause. This case reinforced the value of MDT input in rare disease diagnosis. Number 3. Leadership and management. What to say. Start with giving examples of leading service change or improvement you have done. Explain how you manage your team, conflict situations and resource constraints. Show your approach in strategic thinking. Example: during my registrar years, I led AQIP aimed at reducing A&E admissions for chronic obstructive pulmonary disease. By introducing a same-day respiratory assessment slot, we reduced unnecessary admissions by 18% over 6 months. I worked closely with A&E and primary care colleagues to implement the change, and our model was later adopted trust-wide. Number 4. Teaching and training. What to say. Speak about the involvement in medical education. Brief what you have done for the development of educational material. Talk on future ambitions in teaching. Example: I've been actively involved in undergraduate teaching, delivering weekly tutorials and bedside teaching. I also created a simulation-based learning module for managing acute breathlessness, which is now a regular feature in our regional teaching program. I'm keen to pursue formal roles such as educational supervisor or college tutor. Number 5. Audit, QI and research. What to say. Provide examples of completed audits, and how those impacted on service. Name the research projects you're involved in, explain them your future plans or interests. Example: I recently completed an audit on steroid prescribing in asthma discharges, which revealed 30% non-compliance with NICE guidance. After presenting to the clinical governance group, we introduced an electronic checklist that improved compliance to 92% in 3 months. I have also published on ILD case series and am keen to collaborate on future registry studies. Number 6. Governance, risk and safety. What to say: how you respond to errors, incidents. Understanding of clinical governance, participation in safety initiatives. Example: I was involved in an incident review where a patient was mislabeled in the lab system, leading to incorrect antibiotics. I helped conduct the root cause analysis and contributed to the development of a barcode verification system. This experience taught me how open reporting and a learning culture improve patient safety. Number 7. NHS values, communication and compassionate care. What to say. Empathy, respect, equality, inclusion. Handling difficult conversations. Cultural competence and patient advocacy. Example: I recall a case involving a young patient from a non-English speaking background who presented with tuberculosis. I arranged for interpreter services and coordinated with public health to ensure follow-up. We also involved the family sensitively, explaining the implications and treatment plan. The patient remained adherent and recovered well. It reminded me how vital communication is to outcomes. Number 8. Scenario-based questions. Use the STAR method: situation, task, action, result. Example question: tell us about a time you had a conflict with a colleague. Situation: during a busy winter rota, a colleague refused to attend an urgent referral. I was on call and needed urgent input for a deteriorating patient. Task: I approached him directly and calmly expressed the clinical need and risk. They explained they were overwhelmed, and I arranged temporary cover to help redistribute workload. Action: we later raised the issue with rota coordinators. Result: it helped prompt a wider review of workload equity and handover safety. Number 9. Understanding the consultant role in job planning. What to say: understanding of 10 program activity job plans, such as direct clinical care, which includes all the time you spend face-to-face with patients. And supporting professional activities includes behind-the-scenes work like teaching or management. Express your willingness to contribute to admin, teaching, and quality improvement. Also explain your flexible, team-oriented, proactive approach. Example: I'm fully aware of the expectations for 7.5 direct clinical care and 2.5 SPA program activities, and I value SPA time for teaching, appraisal, and QA. I'm happy to work flexibly across sites, contribute to on-call rotas, and take a lead role in service development. I also hope to get involved in the upcoming EPR implementation as a digital lead. Number 10. Your vision and future plans. What to say: explain how you will evolve the service. Brief your long-term professional goals and your commitment to the trust and local population. Example: in 5 years, I hope to help expand your integrated respiratory service by establishing virtual MDTs with primary care. I also plan to become an educational supervisor and continue contributing to research, especially in early cancer diagnosis. I see myself staying long-term and being part of shaping the department's future. Arrange mock interviews with colleagues or mentors. Get feedbacks on clarity, professionalism, and confidence. Practice makes you more confident. Wish you all the best and good luck.